I'd like to thank and acknowledge all the consumers who contributed to this presentation. They came from inner and outer Melbourne, Geelong, Ballarat, Ararat, Bendigo, Portland, Port Fairy, Shepparton and Warrnambool. Many and their partners contributed many positive stories of the care they received and also identified areas that need improvement. Today, I will share our priorities for improving access to care and the support provided at diagnosis and treatment planning. Surveys and focus groups identified some priorities for improving access to care. These included access to robotic surgery through public hospitals and regional areas. This is a particular issue for men on low incomes who do not have access to paid sick leave. Longer recovery times after open surgery can create significant financial stress for these men. Other priorities are affordable access to PSMA PET scans, access to specialist nurses, and the time and cost associated with travelling to appointments and for imaging, particularly for men who live in rural areas. Others were content to travel long distances to access robotic surgery in Melbourne and receive follow-up locally. Access to PSA testing generated a lot of strong responses in surveys and focus groups. Many expressed distress at late diagnosis after repeated attempts to access a PSA test. Others expressed frustration, anger, confusion, and a sense of having to fight to access the test. These are some of our experiences in relation to PSA testing. We know the PSA test is not perfect, but it's the only test we have. We ask for your help to advocate for changes to PSA testing guidelines and educate GPs to provide a more nuanced approach to testing. Experiences at diagnosis and treatment planning varied. Some men felt shocked at the severity of urinary incontinence and sexual changes after treatment. While side effects were mentioned, they felt they were sometimes underplayed or stated it was hard to process the information. Some men were left wondering whether they made the right treatment decision and did not have the reassurance of knowing they had made the best decision by having a second opinion or multidisciplinary recommendations to fall back on. Some of us received really good information. It really helped when we were encouraged to consider opinions and options and were allowed time to make decisions. When we were gradually given information, including straight talk about side effects. And when we were encouraged to get a second opinion from a radiation oncologist or were offered a multidisciplinary meeting discussion and were informed of the recommendations or both. Finally, it helped when we were told about peer support options like support groups. Informed financial consent and early consideration of financial resources was also highlighted as an area for improvement. The importance to consider the real cost of prostate cancer when planning treatment. Men treated privately described big differences in and out of pocket costs. For men with limited or no paid leave and those on low incomes, managing the cumulative cost of prostate cancer can be stressful, even if they are treated in the public health system. One man from regional Victoria described being unable to afford the rent and relying on his food vouchers from a local minister as he was unable to cope at work due to radiotherapy related fatigue. 2 years later, he found out about Centrelink support that he could have accessed. Please ask about our financial situation and leave entitlements early. Link us with Cancer Council Victoria and or social work support early and consider referring to public subsidised services where appropriate. Thank you for the care you provide to us and for the opportunity to share our priorities for improving Victorian prostate cancer care. In summary, our priorities are: improve access to public hospital robotic surgery in regional areas, affordable PSMA PET scans and specialist nursing support, improve access to PSA testing and consistency of information about PSA testing, reduce variation in experiences at diagnosis and treatment planning. We feel well supported when you allow us time, inform us, discuss our treatment plan with your multidisciplinary team, and link us with financial support early where needed. We cannot make an informed decision if we're not informed.